Hi, my name is Sherma Francis, and I am Dr. Owusu-Akyaw's PA. I'm just going to chat with you a little bit today about what a physician assistant does. We are certified to provide medical help or provide medical guidance for patients. We evaluate patients, we diagnose, and we treat. So let's say you walk into a medical facility. Sometimes you may encounter a PA or a nurse practitioner. We're considered extenders of surgeons or extenders of physicians. Yes, we're capable of taking x-rays, reading those, doing imaging, blood work, assessing your concern or injury, and treating you with medications if need be. I think sometimes people take it for granted when they do see a PA versus a doctor. They assume that we're not capable to take care of them when we are. So instead of spending the amount of years that a physician may spend in school, our time there, duration is quite short, but we do learn a lot of medical information. Most of us are primary base, let's say that. So we can venture into different fields. We're not specialized. We become specialized after associating ourselves with a physician. Like myself, I'm specialized in sports medicine surgery while working with Dr. O. I see patients for any sort of injury to muscle, bone, and I also assist him in surgery. With that being said, I do know a lot about your surgical intervention, so don't be scared to ask me a question here and there. I'm happy to help. My background also is in fitness, which helps tremendously when it comes to seeing athletes. I feel like I have a strong connection with those athletes out there. Not only passionate about their injury, but I'm passionate to help you regain your ability to go back out there on the field and perform. Patients come into the room and they assume that you are the nurse and you're not able to assist their needs. And they are quite finicky about giving you all the information. My advice to you is pour out your heart and soul to us because we are there for you and we definitely would help you through the process. There are different types of physician associates out there. You can find us in the surgery, you can find us in mental health, you can find us in primary care, oncology, pretty much any specialty we can be extenders for a physician. I'm originally from Trinidad and Tobago, which is a small island off South America. I moved to the US at a young age and ventured into sports medicine at VCU, which I absolutely love. I've always been an athlete. I played a lot of sports in the islands. And going to VCU, I knew from the beginning that sports medicine is the field that I wanted to pursue. While at VCU, I started a fitness program, and for 15 years, I spent time training women to become a better version of themselves. As a personal trainer, my ultimate goal was to help my clients, understand, the importance of good health and to be a better version of themselves. In saying that, I found a lot of passion in what I did. Throughout the years of being a personal trainer, I realized early on that I wanted more for myself. I wanted to be able to take that next step into guiding that injured athlete to recovery, which is why I pursued going to PA school. In PA school, there was a lot of ups and downs, a lot of no, you can't do this, or no, you're not good enough. And for some reason, I felt in the back of my head that finishing PA school would allow me to at least be in a position where people respect who I am as a professional. And it wasn't like that after leaving PA school. It was quite difficult. It was quite difficult in letting people understand that I know what I'm doing. I want to learn more. I want to help you. We want to be the best extension of whoever supervises us. I often say to my supervisor that I want to be as good as he is or even better. I want to be able to walk into a room and answer a question knowing that those were the exact same words that he would use. I often get asked from patients, so when are you going back to medical school? For those of you out there, I'm done. There's no medical school. I enjoy doing what I do. Growing up in Trinidad and Tobago, making the transition to America, as I said earlier on, was quite a little difficult. Not only a culture shock, but making the decision to go back to school was a bit difficult. There were days that I would sit back and remember stories that my dad told me. And I always remember this one story, which I, to this day, realize what he was trying to say was a lot deeper than I truly understood back then. He turned to me and said, I was washing the car with him, and he said, if another human could do it, so can you. And I didn't quite get that. But moving to the US and putting my head down and grinding, as you would say, to get to where I am today, I realized that my dad was teaching me grit. Yeah, that's what he was teaching me. I came in wanting to do sports medicine, and from day one, if you look at my history, I've started in that field and slowly made my way to where I am today. And it took days of hearing no's, you're not good enough, and I had to just keep my head down and keep working towards becoming that PA that I want to be today, which is in sports medicine and surgery. My dad, I spoke to him recently about it. I was like, you remember when you were tinting the car window? Because he was very handy, very hands-on. And I turned to him and he's like, listen, if another human could do it, you can do it. Anything in life, and it's not a girl-guy thing. You can do it. Put your head down, focus, and get it done. You may not, and he would always say things like, you may not be the smartest or, have the highest IQ, but if you learn your way and push and stay the course, you're gonna get what you want.